Hi, I'd like to thank you all for coming today to your family therapy session. I know sometimes it can be difficult to come to a session like this, so I really want to thank you for coming and participating today. I thought maybe we'd start by going around and introducing ourselves and maybe telling me a little bit of something about you. So, would you like to go first, Mom? Okay. So, your name is Elaine and you are 45. Dad, how about you? Bill, and you're also 45. Okay. And then what's your name? Sarah. And how old are you, Sarah? 14. And how about you? James, and you're 17. So Sarah, what grade are you in school? You're a freshman. Okay. And James, how about you? A junior. And Mom, are you currently employed? Okay. Oh, you're a nurse. Nice. It's a very rewarding job. It can be difficult too. And how about you, Dad? Are you currently employed? Okay, you're semi-retired. Okay. And you work in the computer business? Okay. Well, it's great to get to know all of you. Once again, I'm very glad that you're here. I want to tell you a little bit about how I like to run sessions. I thought that we would use an object. Today we're going to use this flower, but you can use a ball, you can use almost anything. And what we will do is, if you would like to speak or it's your turn to speak, you can only speak if you're holding the flower. That way we can make sure we're listening to everybody and we're being respectful and we don't have a lot of talking at one time so it doesn't turn into an argument. I want to talk a little bit about some goals that you guys want to work on and see where we can go from there. So, Mom, can you tell me maybe a little bit something about your family? Okay. So it sounds like maybe you don't get a lot of support or aren't very close with your family. Okay. And Bill, how about you? Do you have a relationship with your family? Okay. Well, I'm sorry to hear that. Your parents have passed away, but it was difficult growing up as well. All right. Well, thank you so much for your honesty. It sounds like your family has been through some difficult times lately, but I want to continue to hear from each of you about how you're feeling about that. So Sarah, what brings you here today? Okay. Oh, wow. So you were recently discharged then from the inpatient unit? Okay. Anything else going on? Because from what I've read in your case file, you are a very happy girl and you're well adjusted, you're popular, you're very bright. Anything else bothering you at home or anywhere? Okay. So sometimes your parents fight a lot. All right. Well, thank you for sharing. And James, I understand that you have made honor roll and you do very well in school. That's wonderful. So what brings you here today? Yeah. You're worried a lot about your sister and your parents. Okay. Well, thank you very much for your honesty. And Elaine, it looks like you have the flower now. Did you want to tell us something? So you're feeling like you have a lot of responsibilities within the household and not enough hours in the day. Okay. And you're working full-time right now, correct? So it's difficult to get up and then come home, make dinner, clean the house. You feeling a little overwhelmed? Okay. Oh, and now Bill has the flower. Bill, how are you feeling? That there's a lot of arguing between you and Elaine? Uh-huh. And she gets very emotional. Okay. Well, I appreciate everybody's honesty and telling me a little bit about your family. Oh, I did see some people interrupting at times. And I want to remind you with our sessions, you only speak if you're holding something so that we don't have some arguing or people not being respected. So that would be great. You can all just pass that around and you can speak when you're holding it. Okay. So from what I'm hearing, it sounds like you each have some goals that you would like to work on. I heard mom and dad and both of the children talking about communicating, and there's a lot of bickering and yelling. So sounds like you would like to communicate without yelling. Okay. And I also heard mom saying that she has a lot of responsibilities in the home and she's feeling overwhelmed. So maybe we could divvy out some of those responsibilities so that everybody has something they can do to help out. Think that would be possible? Okay. Okay. So Sarah, that's something that you would like to get involved in? Maybe a drug and alcohol treatment just for yourself? I think that's definitely doable. So this week for your homework, what I would like to see you do is sit down as a family, pick one day, maybe every Thursday, for at least 30 minutes and discuss things as a family. You can set up the responsibilities, who's going to do the dishes, who's going to mow the lawn, who's going to help with homework, who's going to do laundry, any of those things. You figure out what works in your family and what you can do. So I'd like you to sit down and set up some responsibilities. And also, Sarah, I'd like you to talk to your parents about setting up your drug and alcohol treatment. Whether that's you making the phone call or your parents, but somebody needs to decide who's going to make that call to set up that appointment. And another thing that I would really like you to do is choose an object in your home. It can be a ball, just like we used the flower today. And when you're having these meetings, one person speaks at a time to help with the communication. Does that sound like a good plan for next week? Okay. All right, well, thank you again for coming. I look forward to meeting with you guys next week and seeing how your family meeting went. All right, thank you.